Hi everyone, my name is Mary Solano and I'm here today to give you some information regarding ADHD or Attention Deficit Hyperactivity Disorder in adolescents. Just to give you a quick overview of ADHD, it is the most common behavioral health problem in children, and it is divided into two separate parts. And the two separate kinds are the inattention type and the hyperactivity impulsivity type. The inattentive type is the children who are unable to organize themselves, they don't pay attention very well, they have difficulty completing tasks. The hyperactivity part is the children that are unable to sit still. They disrupt classes, and they may have issues waiting their turn, like with playing a game or something like that in school. The treatment for ADHD is usually medications, which are the stimulant medications, which can be things like Ritalin or Adderall. And also there's some behavior interventions that can be tried to help with these children's behaviors. One of the issues is that the American Academy of Pediatrics, they developed guidelines for ADHD, but they stopped these guidelines at the age of 12. It didn't include adolescents and young adults due to the lack of evidence that they had at that time. The early idea was that ADHD was something that kids would grow out of once they got to a certain age or they entered puberty. However, they're starting to see that the problems do not subside when puberty comes on, and it's something that can persist not only at the grade school level, but also as adolescents enter into high school. Many children with ADHD continue to have academic, issues with academic achievement when they enter into high school. 58% have been retained in a grade, 40% have used special education services, and 35% of these children fail to finish high school. Children in high school that have ADHD, if they do complete high school, they might take a longer time to complete high school. They have lower rates of college attendance, and because of the ineffective learning in the lower grades, it can affect their ability to develop the higher math and reading skills that are needed as they enter into high school. And students who do poorly lose motivation in academic pursuits. And attention problems are one of the main predictors for diminished achievement in school. ADHD also has, issues as far as society goes and in regard to peer relations. In children with ADHD, peer relation impairment is seen both in boys and girls, but boys are 3 times more likely to show signs of ADHD than girls. The inattentive kind of ADHD can likely cause children not to learn the social skills that are needed from other children because they're not really paying attention to what other children are doing. And the hyperactivity and impulsivity kind of ADHD can lead to, children being seen as being overbearing, and these other kids don't want to have anything to do with them or play with them because they can't wait their turn when they're playing a game. And they're like, oh, we don't want to play with them because, they don't ever play the game right, they can't wait, things like that. And, peer relations are developmentally important to all children. So, And it's difficult to find a treatment or an intervention that can help the kids with the issue with their peers, because nothing has been found that's been effective. Teenagers with ADHD have a distorted sense of self in normal development. They might be excessively aggressive, or antisocial behavior might begin to occur. Also, there's been issues with substance abuse and other things. When you look at Erikson's theory of social development, stage 4 is the industry versus inferiority, and this is the stage from 6 to 12 years old. This is the grade school years, when children need to be successful and productive in their things that they do. They need to succeed at learning and be industrious. Repeated failures can develop feelings of inferiority, hampering their chances to succeed in the future. And then stage 5, which is the adolescence phase, which is the phase that I've been focusing on, is identity versus identity confusion. In the adolescent stage, children are developing who they are and exploring different options for themselves. And they try out roles for the future and integrate them into their sense of self. And then some have confusion about those identity roles and who they are. So as you can see how one stage affects the other, whereas in the grade school years, if children, aren't successful in school, how that can affect them as they move on into the next developmental phase, which is the adolescence phase, and how, the things can cause problems. So when they start having issues as early as stage 4, those problems follow them into stage 5 and into their sense of self as they enter into the adolescent phase. Some possible solutions for the problem is to look at things that are non-clinical or, intervention-based, to help children with attention problems. They could deal directly with the attention problems that are seen in the school setting, and because this is where those problems affect the children the most, is within that school environment. And peer rejection, if left unchecked, it leads to a variety of problems such as substance abuse, dropping out of school, criminality, and mental health disorders, which can have a negative effect on children throughout their lifetime. So, as you can see, ADHD is something that it will affect somebody throughout their entire life. They're seeing now that it can even go into adulthood, and these things can, show problems with holding down a job, or issues with, their families, or issues with their spouse if they're not able to perform the tasks that are needed to ensure that they're going to have a productive life. So one of the main reasons why I wanted to look into this, into ADHD, and in particular the phase which happens in adolescence, is because my son, Aiden, he's going to be 15 years old this coming August, and he has been diagnosed with ADHD, with the inattentive type of ADHD. And he was diagnosed with this probably, I would believe, in 1st or 2nd grade, somewhere in there. And I have seen how he has struggled through school. It's just very, very hard. And I've also seen how he has struggled with his peers. I know that he has peer relations at school, because he tells me that. He has friends at school that he, hangs out with and does stuff with. He usually meets these kids at the weight room at school, after school, and he tells me how, they go and they exercise and they lift weights together and things like that. But Once he comes home, there's absolutely no peer interaction with him or any of these kids. When I say to him, why don't you give them a call? Why don't you see what they're up to? He doesn't want to do that, and I can't quite understand why. But even with encouragement, it is very, very difficult to get him to interact with his peers. I mean, he does have kids in the neighborhood that he plays with, or does things with. However, my concern is that they're a lot younger than him. So, it's kind of like the maturity level isn't there right now with him. As far as school goes, I have to say that there have been times where, with homework and things like that, that I have been ready to tear my hair out. It is just, it's so hard at times. And you try so hard to be patient and things like that, but it can really, really get to you after a while. We are still, as we enter into freshman year, we are still at the point where if he has a project or something like that that's due, I have to be right there with him the entire time to make sure that the project is getting done and to assist him with the project. So you can see, as you enter into freshman year of high school, that these are things that you should be able to do on your own, that most kids are able to do on their own, but he's not able to do it. And it's because he loses focus so quickly on what the project is or the goal that we have to achieve. So, like I said, it can be extremely difficult. And these issues all started to come to a head when I enrolled him into a preschool with my school district here. They have a free preschool program for students to enter into that is for developmentally challenged students. But what they do is they have an equal number of normally developing students in the classroom also to serve as role models and things for them. And I enrolled my son into that program as a normally developing child. And it was maybe a few weeks into it that the teacher came to me and started telling me that she had noticed issues with Aiden with fine motor skills. So, at that time, she's like, well, why don't we can do this and we can have him tested and see what's happening. So I agreed to have him tested, and he was found to have a learning disability at that stage. So they were able to enroll him into the program on a 5-day-a-week basis to help him, with some of these problems. After 2 years of that, he was declassified within the school district, and I sent him to a pre-K with a church. So, he did fine. He was okay in the pre-K class, I should say. And we kind of went on from there, and he went back into the school district when he entered into kindergarten. And again, I'm being told, here we go again with the issues and the attention problems that he was displaying in preschool are now beginning to come out in kindergarten. So he was tested again found to have a learning disability, again diagnosed with ADHD of the inattentive type. I've taken him to neurologists, psychologists, psychiatrists, everything under the sun to test him for these problems. But what I've really, really noticed is that it does not seem like he has retained anything that he has learned throughout the years, which really, really worries me as we enter into high school. So, what I'm trying to do now is there is a program, an ADHD program with the Children's Hospital of Philadelphia, that assesses kids and can look at issues, and they have a whole team of people that, look into things to see how they can help these kids. So my goal right now is I want to get him into that program and see what can happen and see what kind of suggestions they can offer to me to help him. So, we're just kind of waiting and seeing. I have a stack of paperwork that I need to fill out before I can even get an appointment there. I'm not even sure my insurance covers it, which is another crazy thing. That's a whole other story, though, that I'm not going to delve into right now, because if I get started on that, God only knows where this will go. But, you have, these are definite issues that, these kids, it needs to be handled. It needs to be handled in a different way. I'm not sure what that way is, but the way how things are going right now is not helping. So I would think that, in my readings and things like that, and the research that I did, one of the suggestions is to screen these kids upon, registration into kindergarten, and look for signs or symptoms of ADHD, and try to kind of, nip these things at the beginning to see what services and things like that can be provided. And I know I might sound like I'm contradicting myself, because I know that my son did have these issues when he entered into kindergarten. But I don't think that the interventions that were put into place were the ones that were the most effective for him. And I'm seeing it more and more as we progress into the higher and higher grades. Another example of something that he should be able to do on his own, but he can't, is his summer reading project. It's like pulling teeth to get him to read a book and to tell me what the book is about, and to tell me the names of the characters and what's going on in the story. And I know exactly what it is. While he's sitting there reading, he might be looking at the page, but he's not retaining the words on the page. His mind is somewhere else. His mind is on, the faster I get this reading done, the faster I'll be able to go back to playing my video game. The faster I'll be able to get back to going outside and riding my bike. And that's the way how he thinks. And the other thing is that he does not really grasp the concept that this is something that's important. So, it's very, very hard. This summer reading book, luckily, is a book that I read numerous times when I was his age. So I know the story, and I know what information he should know and what he should be able to write about. But, it can be so hard and so difficult. And I remember a few years back, I had actually read an article on schools and the way how they teach children, and how the way they teach these kids is definitely more geared towards girls than it is towards boys. And boys have a totally different way of learning than girls do. And, it's something to look at and to consider when you read something like that. Because to be honest with you, I have 2 older girls. I have one that's in college, and I have one that's about to be a senior in high school. No issues with either one of them as far as school goes. Not one single issue. And these girls have the same parents that my son has. And you have to sit there and wonder, the only difference is that he's a boy. So it makes me stop and think, is that the problem? Is it the way how the schools are teaching kids? Could that be something that could be looked into in the future to gear it more towards both boys and girls? These are just ideas that I throw out and I think about, that I'm trying to wrap my head around to see if there's something that can be done. And I have to say too, I have absolutely, positively no experience when it comes to schools, none whatsoever. I'm a social worker. I've been a social worker for over 22 years, but my main focus has always been with the elderly population. So I know nothing about kids. I know nothing about the school system. So I just know from my experience with my son. So just saying, I really, really do think that we have to, as a society, step back and realize that standardized tests is not, how to pass a standardized test in school should not be the reason that kids are in school. The reason that kids should be in school should be to learn and to become a productive member of society. And who cares if they pass a standardized test? Not everybody can take a test. And believe me, a kid with ADHD cannot sit there and grasp the concept of a standardized test and to be able to sit there and pay attention and really focus on what they're doing. It's impossible. It's virtually impossible for these kids. So that's just the way how I feel. Just voicing my opinions right now. So anyway, for anybody that would like to get some more information on ADHD, I would really seriously encourage you to go to the Children's Hospital of Philadelphia's website. If you go on there, under, I think it's Departments and Services, there's a link for the ADHD program. And within that, on that web page, there's so much information, and there's so many doctors and psychiatrists and psychologists that have done studies on ADHD and explaining everything under the sun about kids with this problem. And it's extremely interesting, and there's a wealth of information there. The website for the Children's Hospital of Philadelphia is www.chop.edu. And I would encourage anybody who would like to get more information to please go to that website. But again, like I said, from the research that I have done on this topic since the beginning of this class, I have to tell you that this problem with ADHD is a problem that is going to persist throughout these kids' adult life. And it's something that really needs to be looked at. And you want to know something too? I'm 45 years old, and I have to say that there's probably a million kids. Well, not a million, but you know what I mean. Like, there's probably so many kids in my class that today would have been diagnosed with ADHD. And I don't know if it's just, the way how we think as a society. Like, I don't really know. I don't know why there's so many diagnoses right now of ADHD. So it's just something to think about too. Like, how often did you hear of this when you were growing up, when you were in school? Probably not a whole heck of a lot. So just saying. But again, like I said, it's going to affect kids in every aspect of their life, from grade school through high school into adulthood. And that's why it's something that really needs to be looked at and seen to see maybe there is another way. Honestly, I don't know what the way is. I wish that I could figure something out, but there's got to be a way to help, nip this problem in the bud and maybe be able to have these kids become not so confused about themselves and not so, just giving up when it comes to school. Education is so important, and that is something that I try to instill in my children. So you know, it's an important aspect of life, and I really do think that it's something that needs to have some greater attention placed upon it. So, again, thank you everybody for your time and everything like that. And again, please, like I said, if you want to get more information, go to the Children's Hospital of Philadelphia's website. Thank you.